Welcome back to Recovery Channel. I'm Brian Ariel, Treatment Director of the Outpatient Recovery Program with Applied Care Services. We've been reviewing some comments again and found that on changing the mind of addiction, that we've got some comments that they're real people, obviously, that are agreeing and saying the stigma around addiction, especially around our family members, are really keeping people from seeking the help that they need. And so let's look at some of the things that are a barrier to people entering treatment or even asking for help. So number one is shame and self-stigma. So when we're addicted to things and we're told that we're less than, or that we're an addict or dirty or whatever, we find that we shame ourselves. We feel like we're worthless and that we don't deserve help. And that's not the truth. The truth is that for some reason we've got hooked into this addiction, this substance use. Maybe it's an escape from pain. Maybe we fell into it through experimentation or just daily routine. So the only barrier is to forgive yourself and to move forward and to ask for the help. But some people can't because there's also judgment out there. So when you're driving down, I drive around Minneapolis or St. Paul and you see someone stumbling around or passed out, it's hard not to kind of go, whoa, look at that, oh, I'm glad it's not me. That's our own biases. That's our own stigma against that, instead of going, wow, I wonder what happened to that person, what happened in their life to get them to that point, and why won't they ask for help? When we think of that fear of judgment and discrimination, it extends all the way from, yes, even treatment can have some discrimination. Your medical providers. I did an education and training video on stigma and shame and addiction, and I think it's like 65% of medical professionals have some sort of bias when they see a patient that has an addiction. It's already formed right then and there, and that shades how they treat them or how they prescribe treatments for them. Imagine that you have chronic pain and you also have an opioid addiction because you're over-prescribed, and then you see where this is going, and then they say, no, you can't have it anymore, we're just going to cut you off. And so now you got to figure out a new way. And so that is basically like that judgment and that fear of discrimination. Like, I don't want to talk to my doctor again because he's just going to think that I'm pill seeking. And maybe in the past you did, and maybe now that you have accountability in your life and you're managing things the correct way, you know what works, but yet we might be really adamant, I need this, and that raises that flag. A lack of understanding and empathy. So stigma often arises from misconceptions. Like, you're lazy, you're stupid, you're uneducated, you don't know what you're doing, you have a lack of morals, you have a lack of willpower, and all those other things. It gets tiring, doesn't it? It's none of those things. Granted, yes, we might be impulsive, we might have a lack of willpower, but when we really boil it down, addiction is a neurobiological response of the brain to substances. It's not a lack of character. It's not a lack of morality and things like that. Granted, undefined or indeterminate values may cause us to make decisions that aren't in our best interests. But that's not the sole purpose, right? So the lack of understanding, what happened in this person's life to bring them here? Why are they doing what they're doing? Could this happen to me? Absolutely. Addiction is one of those things that it knows no race, no creed, no bounds, no socioeconomic class, no political party, no nothing. It will get you. There's no just indiscriminate. It's indiscriminate. It just takes out whoever. You could be a billionaire or a person that lives on the street, and everywhere in between. Professionals, not professionals, teenagers, children, elderly. It hits all of us. So that lack of understanding and empathy, right? That's really us being cold. That's us reinforcing our own biases and our own stigma. We feel ashamed, we feel judgment, and we place that judgment upon others, and then we listen to that stereotype, and well, they're just a junkie, and they made that decision to live on the street, and they made that decision. Sure, but after a while there's no decision to be made. You have to do it. Those of us that have dealt with addiction know that it's not as easy as a choice. It's not a choice. Maybe at first it was. It was poor choices that led us there. But to continue on our addiction, it's not because of choice. It's out of necessity. We have to. It's like air. It's like water. It's like the thing that we need in order to keep on going. And when we don't understand that, we shut people down, we shut them out, and then they go off and they basically die in isolation. A slow, painful death. That's why when we did the video on changing the mind of addiction and stigma, these are the things that keep people from coming in and having a great life. Another one is limited access to resources. And you might be like I was before I got into the field, and like, well, there's social services and all these other services that we pay taxes for and all this other stuff. Yeah, well, let me tell you, they're overwhelmed and overburdened. And to get into a good quality treatment program, or to find someone that is going to meet you where you're at, can be a challenge. And so do your research. If there's a lack of resources, call around. Try to figure something out. You can call social services. You can go on a couple websites. In Minnesota, we have Minnesota Fast Tracker. You can find treatment programs for mental health and those other substance use, and then call them and figure it out. What's going to work for you? Sometimes we have to get creative, and sometimes we have to look for resources where we may not find them. It might be at a community clinic, it might be at your church or synagogue or temple. It might be many different places, but if you're willing to look, you'll find something. So education and awareness, get educated about addiction and the complexity of it. If we don't know, then this is the fuel for our biases and our stigma and our shame and those things. If we understand what happens in the brain when we take a substance and why we can't stop, and we understand the addiction cycle, now we understand why someone can't stop. When we look at changing language, changing the shaming language that goes around junkie, addict, tweaker, all those other things, that those things are made to shame, to try to correct behavior, but really it shames and keeps that self-induced stigma where they receive from other people. It keeps them where they're at. So we need to change the way we use our language, and not to beat down or to shame, but to elevate and to illustrate, hey man, seems like there's a problem. This is not healthy. I think you need help. Not like you tweaking junkie. What's your problem? No, that doesn't work. We know this for a fact. And shame on you if you use that kind of language to someone who's struggling with this disease of addiction. Sharing personal stories. There's lots of times where I share my story sometimes with people, and they share their stories with me. And it's amazing to see how you can resonate with another person when you share your story about how you got into and are getting through addiction. It reminds you where you were and where you don't want to go again. I have a friend that says, don't get too far from the gutter, right? Know where you came from so you don't return. Advocacy and policy change. So there's lots of policies out there. States have policies, federal government has policies, communities have policies. Are you involved in advocating for the right policies? I know in Minnesota we just passed legalized cannabis. I'm mixed on it, and I don't think it's a problem. It can be a problem. Is that the right policy? Is that the right thing? Were they really looking out for people? I don't know. I don't want to get into that world. But it's definitely going to have consequences either way. And are we ready for those consequences? Are we thinking through when policies are made? I don't know. That requires you to get involved in, along with this education and awareness, and talk to your people, your elected representatives, and share with them your concerns and what you think could be part of the solution to the problem. And look for solutions, not just throwing money at things, but actually evidence-based, solution-focused things that will help people right now. Creating supportive environments. So when you walk into my office, we support you, but not everywhere. And some communities feel like support would be like a needle exchange or a safe place to use drugs and all those things. I may really disagree with those things. However, it's creating a supportive environment, but cultivating supportive, non-judgmental environments where families, workplaces, and those things where when you're in recovery, it's accepted. It's not looked at like, well, I'm not going to hire you because you're in recovery. I'm not going to interact with you because you used to be an alcoholic, or you used to be an IV drug user, or you used to smoke meth. Not focusing on the past, but looking at the potential of the person that they're becoming, or they are. Because we're not what we used to be. We're not our disease. We're not identified through that. We are becoming something better, something beautiful. So I hope that this finds you well. And stigma is a really big barrier. And I hope that this has raised your awareness and has helped you, or even supported you in finding a way through your own stigma. And the biggest thing is, try to get out of your own way. Have compassion on yourself and be willing to ask for help. This is Brian Ario with the Outpatient Recovery Program with Applied Care Services. Have a good one.